Welcome to today's webinar. We are doing a Transforming Clinical Practice in partnership with patient and family advisors from philosophy to action. And we're so excited that you're joining us today. I'm Marie Abraham. I'm the Vice President of Programming and Publications at the Institute for Patient and Family-Centered Care. And I'll be the moderator for today's webinar. So we invite you to chat in your questions and comments, and Jacinta and I will make sure that the presenters respond to them during the Q&A portion. I want to introduce our wonderful team of presenters today. We have Juliet Schluchter, who is the Director of the Center for Child and Family Experience at the Sala Institute for Child and Family-Centered Care at NYU Langone Medical Center. Juliet has more than 2 decades of experience working with and leading healthcare professionals in patient and family-centered care assessment, programming design, and implementation. She consults on patient and family-centered topics related to quality, safety, education, research, and outcomes. Prior to joining the Sala Institute, Juliet worked for 15 years with the leadership to advance a model of patient and family-centered care at the Children's Hospital of Philadelphia. Juliet came to her work over 22 years ago following her son and daughter's diagnoses with cystic fibrosis. We also have Amy Lenz. Amy Lenz is the Program Integration Manager for VHQC, which is the Practice and Transformation Network serving Virginia, Maryland, Washington, D.C., and the organization, and West Virginia, and the Quality Innovation Network, Quality Improvement Organization for Maryland and Virginia. Amy ensures that VHQC's goals for task integration, peer-to-peer learning, patient and family engagement, and disparities reduction. She leads an internal patient engagement planning committee, coordinates VHQC's Patient and Family Advisory Council, and drives progress on internal quality measures for including the patient voice in all phases of quality improvement. And we also have Deborah Brown joining us, and Deborah Brown is an advisor for VHQC's Patient and Family Advisory Council. She has over 35 years of experience in healthcare as a caretaker and as an active volunteer for the Virginia Breast Cancer Foundation. And we welcome all the presenters today, and I'm going to hand it to Juliet Schluchter. We do want to remind you to please chat in your questions or comments.
Great. Thank you, Marie, and I'm delighted to share this presentation with Amy and Deborah today. And thank you to Jacinta at the Primary Care Collaborative for all of your support and focus in making this webinar happen. So welcome to everyone on the line. Just to review the objectives today, we want to talk about the goals and metrics that you've all received in your Transforming Clinical Practice Change package. And by now you've, I'm sure, received the Excel chart for how you'll report on accomplishing those measures and metrics. So we want to talk very candidly about what those are and how today's webinar can really be an asset or support you in that effort. We want to identify strategies for clinical practice improvement through partnership with patients and families and really move from philosophy to action with you today. And then wonderfully, Amy and Deborah are really going to take that partnership into a clinical setting and share with you how in a very grassroots way they began their partnership with family advisors, how swiftly they were able to move to some really important initiatives, and then they're going to share what the impact of those initiatives has been at VHQC. And then we really want to talk about barriers that any of us encounter when we try to advance this work and talk about those strategies. We'll be reserving time at the end to really talk about your specific challenges and barriers, and would also love to hear about your successes. So let's begin with that Transforming Clinical Practice goals that we all received across the country in the last 5 months. And this can read like a lot of philosophy, hence our title of Moving Philosophy to Action. But I think what's really important is as you review your change package is how front and center the CMS placed patient and family-centered care design. So really looking at patient and family engagement as a secondary driver for patient and family-centered care design. Team-based relationships, things that we won't talk about today but are very much a part of your change package. They went on to take a look at that patient and family engagement and look at design goals for all of us. And these are the 4 design goals for patient and family-centered design. That we create our healthcare setting so that it clearly respects the values and the preferences of those we deliver care to. That we have training and that we have a culture that builds time to listen to the patient and family voice. And we're going to talk today about, clearly that's an important practice that you've incorporated into your care of patients and families, of listening to them in the experience of care. But we also want to talk about how valuable it's going to be to support programs in your setting where you listen to the patient and family voice on the design of care. The third goal is to collaborate with patients and families, and we do think of that as this notion of collaborating with patient advisors, and then to be aware of language and culture. So for all of us who lead this work across the country, we ground this in a foundation around the principles of patient and family-centered care. And so it was great to see these 4 components of family-centered care design in the change package, because I think they really mirror the work led by the Institute for Patient and Family-Centered Care around building a culture and an infrastructure that supports patient and family engagement. So this beautiful definition of family-centered care is that it places emphasis on mutually beneficial partnerships. As you share this work with your partners in your practice, those 3 words are really important to us. But this is not just about the patient experience. We think the patient experience is a really vital component of transforming clinical care in America. When I ushered my 2 now young adult children from pediatric care to adult care in their primary care setting, but also in their specialty clinics, having a solid patient and family experience is absolutely important. But the work of patient and family-centered care really acknowledges the expertise and the experience of you, your partners, your staff, and your clinicians. And that's why those 3 words are so important. This really needs to work for everyone. And sometimes I think as we look at CG caps or the way we're measuring patient satisfaction, we may lose sight of the fact that we want to build an infrastructure that is sharing expertise and working for everyone who not only experiences care, but delivers care. It goes on to say that this is between patients, families, and the healthcare professionals, and it acknowledges that families, however they're designed, so really getting to those pieces in the change package around respect, culture, and value, that however a family defines itself, they're essential to patients' health and well-being. Rarely do patients arrive at our doorstep without a family member. And if the family member isn't necessarily right there in front of you, often getting text messages from your patients about what's going to happen next, when the test results will be in. And so we think of this not just as the patient in front of us, but the family that is often really tasked with maybe carrying out all of the caregiving or fulfilling those scripts or going to the durable medical supply store, so that they are essential to patients' health and well-being. And increasingly, this partnership work, it absolutely influences the experience of care, but we know it shapes outcomes. We know that self-management and self-efficacy improves if we've designed our healthcare experience in one where the patient and the family is our partner, not only in the design of the materials, but in the shared decision-making. So that definition is supported by 4 core concepts. I really call our attention to these because these are in your change package. These are showing up in those design components in your change package. That people are treated with respect and dignity, just as the first design component from CMS states that healthcare providers communicate and share complete and unbiased information with patients and families in ways that are affirming and useful. So all of the work about listening to families, sharing information with families, that patients and families are encouraged and supported to participate in care and decision-making at the level they choose. So you're now going to be tasked with reporting in your, on that Excel chart that you received with your TCPI package on where are you in your practice in supporting families as co-decision makers. And so a lot of the work that the Institute for Patient and Family-Centered Care has advanced really talks about very specifically how do we support the participation in care and decision making. And the last one, and it happens to be the other metric you'll be reporting, is collaboration. Do we have systems in place in our care setting where we formally and informally collaborate with patients and families at the policy level, at the program development level, in terms of the education pieces that we are giving to families and possibly even staff, as well as in the delivery of care. So I wanted to just spend this introductory piece to really talk about how well this is aligned with the work that you are leading on the front lines. So want to make a real important call out here that we're going to be talking about things like a family advisory council and family advisor programs and even family advisor applications and interviews. And we acknowledge everyone on this call. Marie has been a long partner in this work for these last 2 decades, and at any point in time, we work with organizations that are at any point in this continuum. We acknowledge that on the call today, many of you may feel like you're just starting out. You just opened that change package. You just looked at what you're going to be reporting on. And concepts like establishing a family advisory council may seem absolutely overwhelming. So what we want you to know on this webinar is we're going to kind of be giving you the whole enchilada, knowing you'll pick and choose what are the things that are most relevant for you. This way, as you continue along this journey, you can come back to this webinar, this slide deck, and find the pieces where you're at journey. Certainly the way you're going to be reporting on your metrics is reflecting on this. So you have an option of 0 through 3 to acknowledge where you are in your practice can demonstrate that this is one of your metric questions for decision making and self-management. We won't spend the time right now on how that's articulated in those 4 scales that you have now in your change package, but I wanted to acknowledge that this is absolutely along a continuum. The great thing is that there is something about this work where once you're just starting out, there is some momentum that happens and you move very quickly into creating a culture that fully supports patients and families as your partners. But then in the other concept milestone that you'll be reporting on is really making sure that families have a chance to give you feedback in many ways, and not just feedback, but actually work with you as co-designers. This might be in some of your quality improvement work, in some of the other milestones around team-based relationships, and it absolutely should be in your operational decision-making and some of the initiatives that you're advancing for patient care. So we'll get started with talking about what that looks like in action when we partner with patients and families. And so I'm going to advance this next slide and see if there we go. So I think a real aha moment happens when people see this definition. In healthcare, we come from a beautiful and respectful tradition of wanting to do the best for our patients and families. It's why we were all called into the healthcare profession, to care for patients and families. So for some people, when they see the definition of patient and family-centered care, there may be an immediate nodding of the head of like, we do this is who we are. And we want to really respectfully acknowledge that that is what the healthcare professional calling is all about. What we've learned over the last 2 decades is that there is a subtle transformation when you shift your thinking of being called to do things for patients and families versus working with them. And families feel it. They have taught us, most importantly, that they feel the difference when they are partnered with in the moment of care. And they can tell when someone who's very well-meaning is making lots of assumptions about what they need or want as a patient or a family, and how powerfully different it feels when the clinician says, I want to work with you and learn from you about what's most important to you. And so that shift is subtle, but I think it could be a teaching opportunity as you go back to your own healthcare setting and share this content, that this quote of doing with rather than to or for is transformational for many people. Sorry, I think my keyboard just has a little delay in making sure that it's going to advance the next slide. There we go. So we're talking about transforming organizational culture, and you may be somewhere along that transformation that we showed in the journey. So let's get started and talk about what, right now it's going much more advanced, what we mean when we talk about a patient and family advisory council. So in our work, we have seen patient and family advisory councils that are powerful, and it is 2 or 3 families or patients who sit with you and your team around a table and talk about a specific initiative. And we've seen patient and family advisory councils that have 25 members and are diverse in terms of their experience and their background. What we know is just getting started and reaching out to that one parent, that one patient, that one family member is where you're going to begin to make a difference. So small or large, a patient and family advisory council is a formal mechanism to really visibly have partnership with individuals and families, and the council's focused on improving the care and the experience. The majority of members are patients from your own setting and their family members. They typically apply to be a family member. They're interviewed and selected, and we'll talk about why that doesn't have to be a burden, but why it's so important. It's one of those touchstones that we know if we do the work in the front end, we're actually going to be so much more successful in the back end. But that front end work doesn't have to be burdensome. We'll talk about quick strategies to make sure that as you're recruiting patients and families, you're doing work that sets you up for success. So this is a forum where patients and families work with your staff or with your primary care setting staff, and they work on initiatives that are important to patients, families, staff, and clinicians. So it's different than a focus group. It's different than saying, what do you think of this marketing campaign? It's really saying, let's work together on creating this initiative to improve care for all of us. And clinician and staff involvement is essential. So a family advisory council, unlike its name, absolutely should have staff and clinicians in that meeting, because you're the ones that are going to hear that expertise from your patient advisors firsthand and move it forward as an initiative. So how do we recruit patient and family advisors? We've learned from experience that there are qualities and skills that make for successful patient and family advisors. Wonderfully, these skill sets are not tied to some advanced degree or some major in healthcare administration. They are really tied to the kind of person that you're collaborating with. So the best patient and family advisors have the ability to share personal experiences in ways that others can learn. They can see the big picture. So they may really be focused on their own healthcare experience, but they understand how their experience can impact the large picture. They have the ability to listen and hear other points of view. And you'll want that quality as you use an hour time with them wisely and want to be sure that not everyone is dominating the meeting, but we're able to really give and take and listen and exchange. They have an ability to connect with people. They're interested and enthusiastic about your vision. So you're looking to improve your healthcare experience, and they want to come on board with you and partner with you. It's great if they have a sense of humor. Sometimes this work requires that. And you want patient and family advisors that represent those who you serve. And so really aim for that kind of diversity. That may be hard at first. Don't let it be your barrier. Get started. Again, you may start with 2 individuals in your practice that you identify that have these qualities. So how do you find patient and family advisors? So one of the things that you want to do, as I advance to the next slide, is you want to really reach out to your clinical leadership and partners across your practice or across the many sites that might be a part of your network. And you want to share these qualities with them. So you might start, if you're the one leading this initiative, by sending an email out and saying, we know that these are the qualities that will make for the best family advisors. When you think of your patients and the families that are with them, do any come to mind that meet this criteria? I would include that in an email that you might send to staff and physicians. I would ask patients and families at the office, and I would make those criteria public. We don't want to make that a secret. This is the kind of individual that we're looking for. Other practices have had success using community health fairs for recruitment or contacting support groups that you may host in a different setting within your practice. The other way is to really reach out across your network and in your community. Sorry, I'm going to just try and get this. You might want to post signs or brochures. Some individuals have had success even using social media. What I would stay true to is making sure that you describe your program, that our practice is working on creating better care experiences for patients and families. And we are looking for individuals who would like to partner with us. And here is an example of the kinds of criteria that we're looking for. And I would really describe what this is going to look like. To the degree that you can, you might share that we are going to meet monthly or we're going to meet quarterly, and these are the first couple projects that we're going to work on. The reason I share that is in some settings this feels like a very new work, and the term patient or family advisors may not be something that people readily think of as something that they can do. But if you say we want to improve our discharge handout so that as you leave our practice, we want to make sure that the paperwork that we give you to go home is clear and understandable, and we'd like you to come help us design that. Families may say, boy, I really care about that because that's something I found challenging. And so they may sign up and come on board because they see a specific role for them. So within this slide deck, I'm not going to spend time on these examples, but you'll have the ability to look carefully at some great examples at Peace Health, some examples at CS Mott in their online, where they actually feature the work of their Family Advisory Council and their Patient Advisory Council. And then finally, an example of a clinic setting that is using Facebook at UMass Memorial Medical Center as a way not only to recruit, but to share their great work with their patient community. So with patients and family advisors, many use an application. Some may start out with a very basic application asking for some identification information. You want to know what's the best way to reach this patient and family advisor. And you can download some of these resources and you can see the breadth of information you may want to capture. Again, find yourself on that journey and take what you need from these resources. But our biggest message today will be to begin, because you can do this by maybe in the very initial stage not having a formal application, but move towards that after you get some momentum. I have a great appreciation for your reality that the TCPI initiative has started, and we all want to begin and feel that sense of momentum. So what are some interview questions? You'll see lots of different examples of this. The Institute for Patient and Family Centered Care website, IPFCC.org, is filled with resources. I always think of the three most important questions, and that's to ask your patient or family advisor, describe a day in your life of coming to our clinic or coming to our medical center. Describe what that looks like. Describe for me what is a great experience for you. And then you may say, describe something that hasn't gone well, and tell me how we might have improved that. To me, that second question of asking about something that didn't go well or something that they'd like to see improved upon really gives you a sense of that collaborative nature we were talking about, because they're going to share with you hopefully in a very constructive way what would have been helpful to them, and then you really see, gee, this is somebody who we could partner with. And I love the last question. If you had a magic wand and could change and improve healthcare for you and your family, what would you like to see? I think this certainly gives you a sense of the energy and the enthusiasm, the creativity and the innovation of a potential patient and family advisor. The point is you want a little bit of screening so that you're not on the back end having to spend a lot of time correcting for maybe a patient who thought that they were interested but really have so much of a negative experience that it's hard for them to move to that positive place. So this is a really helpful screening mechanism. In this work, you really want to inform and educate your fellow staff. So taking the slide deck back with you, if you have a staff lounge, maybe sharing some of the nuggets that you get today from Amy and Deborah, or some examples of how you want their partnership to move this forward. If you have something like a shared drive where you share resources, I recommend putting as many resources as there so that this doesn't seem like it is something that's happening across the hall or something that's happening with someone else, but this is a part of your practice culture. I'd share that definition for patient and family-centered care and the core concepts and have people react to it. Maybe they'll see some things in those core concepts that they'd love to see happen differently in your clinical setting. I'd share what the vision is for Patient and Family Advisory Council, and I'd share those transforming clinical practice metrics so that everyone feels this sense of ownership of moving forward on the journey towards fully collaborating and engaging with patients and families. I would share with them why you want to involve patients and families advisors. And this is a great and thorough list of reasons why family advisors help transform. They inspire and they energize staff. I mean, we have a great deal of sensitivity at the Institute for Patient and Family-Centered Care about the increasing burden on healthcare professionals on the front lines. And we want to help you and assist you in making this not an add-on, but as something that re-energizes your staff and your work. And what we've learned from healthcare professionals that we've worked with is sitting across from patients and families and co-designing the clinic experience is rewarding and inspiring for them. And it actually reconnects them to why they came into the profession in the first place. And there's these wonderful aha moments that Amy and Deborah will share specifically with you. But there is a wonderful opportunity that you connect in your community and you give your patients and families a chance for them to give back too. And that's another lesson learned that we have from the years of running councils. So you want to anticipate some mental barriers that maybe your leaders, your colleagues, or people that work for you may raise as red flags. And we've heard it all. So we wanted to give you kind of a laundry list of things that we've heard that are barriers. This is new work, and it's sometimes hard to bring people along depending on their own bias or their own background. And sometimes you'll hear that, gee, HIPAA is not going to let us do this. And we want to assure you that there's nothing about partnering with patients and families that is a violation of HIPAA. They come to you in response to your recruitment and say that they want to work on this. We want to assure you that patients and families are prepared to respectfully partner with us, and it's all about how we set this up. So we will say, often in a meeting, you're going to hear things about the very good things that we do and the things that we are aiming to improve. And we acknowledge you probably know these better than we do. You experience care in our waiting room. You sit in one of our exam rooms, so you know our dirty laundry probably before we do. But we want to anticipate some of these challenges that may be thrown to us, and be able to say, let's get started, and we'll keep these in the back of our mind, and if any of them are raised, let's address them one by one, but they're not reasons to not begin. So when you think of establishing your Patient and Family Advisory Council, and so that could be that in next month you're going to serve pizza in the conference room and you've asked 2 or 3 patients and family members to join you, and you're going to begin your first council, if you will. Be prepared to bring very specific initiatives to that meeting so that people feel immediately a sense of contribution, so that they can participate in a short-term project and then maybe something more strategic. Give them a real sense that there's a reason you're asking them to be there and meeting. Some of the times that we're brought in to really rescue a council that may not be effective, it's often because those meetings are not used strategically enough to actually begin changing something. So begin thinking right away, what's that one thing we could do better? Is it our signage outside? Is it the wayfinding to our clinical setting? Is it how we register families when they first walk in the door? What's the opportunity that we could begin and be successful with that really needs patients and families to tell us how to do it better? So there's lots of examples again of how you might do this. But now I want to turn it over to someone who is doing it and has a wonderful patient advisor partnering with her. So Amy and Deborah, so happy for you to share your experience.
Great. Thank you so much, Juliet, for letting us join you today. I got to tell you, during your presentation, I just found myself nodding my head and agreeing with a lot of what you presented. And in fact, on your barrier slide, I can almost point out a few that exactly we faced as a team, but we pushed through it. I also want to mention that VHQC, when we started our journey, we really did utilize some of the tools and resources from the Institute for Patient and Family Centered Care. So I definitely want to say thank you for those resources, because it was a big part of getting us to get started as well. Just want to briefly share a little bit about VHQC. VHQC is a private, nonprofit health quality consulting company. We do serve as a practice transformation network and assist physician practices in Virginia, Maryland, Washington, D.C., and West Virginia. Additionally, we serve as the quality improvement organization for Maryland and Virginia. And through this work, we assist healthcare providers in all settings to improve the quality of care that Medicare beneficiaries and patients receive. The focus of our role is to assist providers with engaging patients and families in their practices and organizations. So in addition to supporting providers with these efforts, we as an organization realized we needed to engage patients in our work. You know, we had previously involved patients in some aspects. So for example, we may have had one-on-one conversations with individuals, or we invited them to some of our educational sessions with providers. But we realized that wasn't really partnering with them and involving them in our project plans, nor was it really keeping them engaged with us. So in summer of 2015, our teams, with the support of our team, decided to form a Patient Family Advisory Council to involve patients across all of our company projects and ultimately help support our providers and communities. The council was up and running in April of 2016, and we are now working with 13 advisors. We have 7 individuals in Virginia and 6 in Maryland. The council meets every other month for 2 hours. Some meet at our office in Richmond, Virginia, and others join us by phone or webinar. So how do we get there? Well, it definitely didn't happen overnight. First and utmost, we needed leadership support. And as I mentioned, leadership had recognized the importance of involving patients, but they really needed to be aware of, the time and resources we would need to form the council and maintain the council activities. So going back to summer of 2015, we started having 2 team members spend a few hours of their week to really start this initiative. They began drafting a vision for the council. They created a charter, started on some recruitment materials. And during that time, they communicated with various team members to get their thoughts and input, and really making sure that everyone in the organization was aware of the council, the purpose, and its importance. I'd say things were going fairly well, but about 5 months into that work, we realized we needed focused effort and additional resources to really get to that first meeting and really get the council up and running. And this was about the time I was hired on as a manager of program integration. And in my role, I do work with all of our project teams to focus on patient engagement. So it really made sense to involve me with the council. We ended up forming an internal planning committee to involve more team members across the company. So we now have 5 team members. We also involved a patient representative and a member of our leadership team for that internal planning committee. And for those first few months, we met weekly, and really that was to assist with the recruitment advisors, which I'll spend a little bit of time about that later. We also created an orientation program for our advisors, and the planning committee really supports the ongoing planning of the council meetings as well as the activities. Into my slides here. There we go. So as I mentioned earlier, VHQC works with providers and healthcare organizations. So we really don't have a lot of opportunities to engage directly with Medicare beneficiaries and family members. So therefore, we really had to rely on our relationship with our providers and other organizations to push our recruitment message out. We had organizations such as the Breast Cancer Association, AARP, American Heart Association, and Department of Health distribute our recruitment brochure in their newsletters and through their social media. And then we also distributed printed flyers at health fairs, senior centers, and libraries. So once individuals contacted us, we conducted a phone screening and asked questions very similar to what Julia had described. And we used the phone screening to learn more about advisors, assess their interests, and see if they'd be a good fit for the council. And then following the phone screening, individuals complete an orientation session, and that's about an hour-and-a-half session. And we provide them an overview of VHQC, an overview of the Practice Transformation Network, as well as quality improvement tasks and what quality improvement is. And really that orientation is also to provide better understanding of what the purpose of the council is and describe the role of advisor and go through the core competencies of what we're looking for in advisors. And we also actually had a confidentiality training as well. So we had our first council orientation and meeting at the end of April 2016. And as I mentioned, we do have 13 advisors. I don't have all of them pictured here, but we do have many women, but we do have 2 men. So we're trying to keep a diverse group. And just to give you an idea of their backgrounds, we have one that's a former social worker. We have a couple nurses. We have several caregivers, either professionally or personally. We have one individual that's a retired Navy admiral, another one that's a retired teacher, and one that's a retired psychologist. So their personal and professional background has just been invaluable and just amazing to have all of them together to provide us feedback. So far, we have had 3 council meetings, and a major focus of these initial meetings is to build rapport and establish trust. You know, when I spoke to each of them, none of them knew who VHQC was. And again, that wasn't a surprise to me because we primarily work with providers and healthcare organizations. So, you know, we had to establish that trust with us, but then also take the time to make sure they're comfortable with one another. During these initial meetings, we've spent some focused time describing our projects and discussing the various healthcare topics. I'd say we really had to make a conscious effort to balance how much we are talking to them versus hearing advisors share their experience and thoughts. So a typical council meeting usually, again, includes an overview of a topic. Then we propose a question to the advisors and facilitate a discussion as a group. So for example, at our last meeting, we spent some focused time discussing our activities as a practice transformation network, and then we asked advisors to share their experience using a patient portal. And as a group, we discussed common themes and identified that there are opportunities for healthcare providers to communicate the benefits of the portal, and also listening to patients' questions and concerns regarding the patient portal. And what was really neat is following that meeting, I actually had two advisors, indicate that they were going to follow up with their provider at their next medical appointment and ask about the patient portal and how to sign up. So using this format, it really allows us to hear advisors' experiences, but it also helps us assess who may be interested in participating in a project with the VHQC team outside of the formal council meetings. And then a couple other activities our advisors participate in. They did provide input on the council charter, and that council charter really sets the foundation of the partnership early on. We outline the expectations as well as the requirements of the council. Some of the individuals recruited early on in the process assisted us with recruitment. They provided feedback on our recruitment flyer, which I'll share with you in a moment. And some of them distribute the flyer through their networks within their communities. They often provide feedback on our consumer-facing materials. Again, I'll share an example of that in a moment. Some of our advisors have attended our educational webinars that we host for our providers, and that really allows them to receive additional information to help with their self-management. Some of them have actually said that, by participating in the webinars, are able to go back and share what they learned with their family and friends. By having them participate in the webinars, it also gives us the opportunity to get feedback from them. Ask the question, was there enough emphasis on the patient? Holding us accountable to making sure that we're, including patient stories and examples on our webinars. We've had a couple advisors participate in national webinars such as today. And we're really starting to bring advisors into different meetings with our teams, beyond, again, the council meetings. So we have had two advisors meet with one of our teams focused on addressing diabetes. And we're talking about including a couple of advisors in the next couple of weeks to kick off some new projects. And going back to that barrier, it was literally this week I heard one of our team members say, "But we don't even know what we're doing yet for this project, and I just don't want to look disorganized." And what I told them is, you have to trust me and you have to trust our advisors. We just got to jump in and bring them into our work. And during this entire process, we've been very transparent with our advisors. Let them know that this is new to us, and they truly have just made it so easy for us to move forward. So it really has been a great partnership. As I mentioned, advisors do provide us input on consumer-facing materials, and they can do that in a variety of ways. They can either email me a summary of their thoughts, they can call me, but what we also did is we created this material review form, and it just gives advisors an idea of some of the things we want them to consider when they're looking at our materials. And I know that form is a little hard to read on your screen, but it has those questions listed on the slide, and then underneath each question, individuals can select yes, somewhat, or no. And if they select someone or no, we ask them just to explain. So here is an example that early on, I think was in that first meeting, we shared with them and asked for their feedback on our advisor recruitment brochure. And so this is what we had originally, as VHQC had developed before we had advisor input. And it was just a one-pager, provided a little bit explanation about the opportunity to volunteer with VHQC. Based on feedback from our advisors, we did change the picture to represent a more diverse population. And then we also added the vision statement, the vision for the council. On the back of the page, we included a list of frequently asked questions. And this was really to provide individuals more description of the activities they would be involved with, and also clarify the commitment of every other month meetings and activities. Here recently, advisors provided feedback on materials we are currently developing for the Blue Bag Initiative. And this initiative is intended to help patients take an active role in understanding their medications and how to use them safely. And so the intent was to have advisors provide feedback on these materials, which they did provide. They indicated areas we needed to clarify terminology. They provided some additional questions for us to add to our evaluation form. But what was really neat is the advisors started asking questions specific to the project. So, for example, they would say, how is this program advertised to patients? Or how can I distribute this information about this project in my community? And so as a result, we're actually planning a follow-up discussion with advisors and the project team to really get into, the project itself and really get their feedback on our plans moving. I'll end by summarizing some of the key things we've learned. It takes time and dedication, but I can tell you it's absolutely worth every moment. Every team member that has had the opportunity to interact with our advisor, we walk away and we're like, this is the best part of my job. Sometimes I get a call with Deborah, who's joined me today, and you know what? She just brightens my day, and it also causes us to pause with the questions or the comments and really start thinking about how we can approach our work differently. So definitely worth the time and dedication. It's also important to make sure everyone in your practice or organization is aware of the council, so they can become involved and help identify activities to involve advisors. Again, the council should not be separate from our project teams. So we're really starting to remind our teams, what are some projects we're working on so we can bring our advisors into the team planning outside those council meetings. It's also important to allocate resources. So maybe you can't form a planning committee, but do recognize it does take some time and resources to get started and to help organize meetings and activities. Most importantly, I would say be flexible and recognize you don't need all the answers. I wish we would have realized this earlier on. In the beginning, I feel like that is really what got us stuck sometimes. We wanted to have everything perfectly lined up and have all the answers. But it was our patient advisor on our internal planning committee that really pushed us. And she said, listen, guys, you just need to jump in and get started. And she indicated that advisors would partner with us and get us to our answers. And that's the point of forming the council. They're there to help us and provide us direction, and she was absolutely right. I'd also say, if you recruit the right individuals, you'll get the ideas and results that you're hoping for. 5 months into forming the council, we are really starting to get to know each of our advisors a little better, identifying their interests and their background, again, to really start bringing them into our projects. So we're really excited to shift from not only having them review materials and participating in council meetings, but to integrate into our project teams. So now it is my pleasure to introduce one of our advisors, Deborah Brown. She has been a fantastic partner, and I just want to turn it over to her to share a little bit about her experience on the council.
Thank you, Amy. You guys wouldn't believe just what happened. It blinked out on my iPad, so I had to quickly go to my phone. So I do want to thank everyone for allowing me to be on the call. I hope that you can hear me.
Yes, we can.
Okay. I'm sorry about that. But today I'm very grateful to be on the webinar invite. Truly, it's really an honor from the beginning of the first time when I heard about VHQC through way of Virginia breast cancer. I've seen it in a newsletter. And the first word that jumped out at me that really captured my interest was the word family. And to me, family is very important, number one. And then when I looked at it backwards, family, then patient. And being in a healthcare setting myself daily, I be with clients every day, and a lot that I be with have became my family. So from March, when I first saw the first newsletter, I had to dial a number and get connected to VHQC, which that led me to speak with Amy Lynn. And when we began to talk and she told me a little about VHQC, my interest sparked instantly. I knew that I was at the right place at the right time. And from April, when we first started the advisory council, I was so excited that I drove from Newport News to Richmond, Virginia. I didn't even know where I was going, but also I knew I was going headed towards the right way for the right cause. So when I sat down and met with the members of VHQC and the three other ladies at that time, along with myself, I instantly found, again, the word family within that room that particular day. I'm very grateful, again, from April to now. I was just counting the months that went by so quickly as Amy was talking. I can't believe that that many months have went by so fast, and we have covered a lot of ground through the webinars and just passing out flyers. And, you know, I myself on a personal level have been able to take a class, a chronic disease self-management leadership class, to be able to go out and share the knowledge that I've learned through the chronic disease self-management. I'm just overwhelmed every time I get to hear someone, you know, just invite me to share my happiness and my joy to be able to get more knowledge to go out and share with people. You know, that it's very, very important that we understand that patients and family do have a voice, and that their voice needs to be exercised and it needs to be heard. Again, I'm very grateful today that when we talked about the patient portal, I myself got a chance to see that in action with my own two parents that live in Philadelphia. I'm living in Virginia, so I'm able to use that and speak with doctors and get knowledge. And I only gained that knowledge through VHQC when I joined on. So again, I say I'm very, very grateful for so much ground that's been covered so far. And I know that we have a long way to go. But again, since I've joined VHQC Advisory Council, I haven't stopped smiling yet. I haven't stopped smiling because I know that I'm in the right place at the right time for times such as now, that people need to know that there's people that really care about them enough to get them the information and to get them to understand that they have choices today. They have choices to sit with people that can basically help down and understand, even yet choosing the right hospitals to go and get surgery. Is this the right hospital for me? Is this the right doctor for me? So I'm just excited. I'm excited for the next level where VHQC is going, because I'm going with them no matter what. So I always keep a smile every time I know that we have a meeting coming up, because I come with my own questions. I come to hear from my family of council members and the staff at VHQC new innovative ways that can help us all. And every time that I take a stab at thinking of like a quote from someone, I think about Helen Keller when she talked about, alone we can do so little, but together we can do so much. And I believe in that, and I stand on that with VHQC, because I know that Together we can do it. Whatever it is need to be done. We're not in this alone. And I know, again, I'll say it over and over, I know that I as an advisor, I know that I'm in the right place at the right time. So today I want to say thank you for allowing me just to share my little story and to be a part of a wonderful family that has the future and the people's lives in their hands, that they want to get the information out to them so that we can all have better lives in our future times. Thank you so much.
Thanks, Deborah. I really appreciate it. And I know we're running short on time, so I'll just quickly share that, because of advisors like Deborah, we really have seen a change in our culture, and, we're just really excited to look forward to the next 6 months. And Julia, I'll turn it back over to you.
Thank you. And Amy, thank you for introducing us to Deborah. Deborah, as I was looking at Amy's slide on some of the qualities and impact, you were just touching on everyone beautifully. The fact that you were so flexible with your iPad and you lost connection and then came back to us, but so appreciate your enthusiasm, and you've just had so many moments of testimony about the impact that this can make on an individual family and like yours and your parents who are remote to your care, but also the impact on a healthcare system like VHQC. So I'm just going to close quickly by saying do the planning up front to choose the kinds of empowered and engaged and enthusiastic advisors like Deborah. It really will pay off. Keep your agenda and your work focused and doable. Measure your impact. So the guide that you have in the TCPI change package that shows you your metrics, in essence, they're really asking you to measure how this impact is happening in your care setting. And you're going to be soon reporting that you're all threes in patient and family engagement. Reach out to the Institute for Patient and Family Centered Care. They can provide coaching calls, they can provide on-site consultation. There is really a lot of resources out there to support you. Just some critical success factors is to really share and broadcast your work. Make it very transparent. That's going to create the enthusiasm and the momentum. Choose something that's very doable up front, and then absolutely celebrate your success with your patient and family advisors. They're really there to partner with you, as you so beautifully heard from Deborah. And Amy has such a practical experience. I know Amy has her contact information too, to reach out to her. Thank you. Thank you all for participating, and we'll open it up to questions.
Well, thank you, Juliet and Amy and Deborah. This was wonderful. It was so great to hear from Amy and Deborah, particularly because you're newer to this, but you certainly hit the ground running. It's hard to believe all of the wonderful things you've already accomplished in just a few months' time. But it sounds like the other thing that you did was really set the stage very well in your organization for the Patient and Family Advisory Council. So we are moving into the question and answer period, and I invite you all to chat in your questions now. I see some questions already starting, so that is wonderful. If any of you are out there who have started an advisory council or have some experience, it would also be great to chat in your experiences or other recommendations from you. So Jacinta, I think we're all set to go with the Q&A. Great. So the first question to Juliet as well as Amy and Deborah, are the advisors offered a stipend?
That's a great question, Marie. We see every model out there. So depending on your setting, I support family engagement in Manhattan, in a very urban area. Having our family advisors come to meetings, whether it's for the NYU SAN, which we support here or whether it's for the hospital-based counsel, is a sacrifice. Families have to get on a subway or pay for parking or pay for bridge tolls. So we have made arrangements to offer a modest stipend to support costs. That's how we reflect that. I've been in settings where it's free to park, it's easy for families to get to the meeting, and the culture in that community is that this is volunteer. And I've seen everything in between. So I think it really has to do with your culture. I do think it's wonderful to offer even just a wonderful meal. So if you could have the luxury of planning a wonderful dinner around the meeting time, I know that those kinds of things go a long way in honoring the contributions of your patient and family advisors.
And this is Amy with VHQC, and I wish we could offer a stipend, but as you may have recalled, ours is a volunteer base, and that's due to our contract funds. We are able to reimburse advisors for travel, for when they travel in, but I've only had one actually turn in a reimbursement form, so it hasn't stopped us, but it sure would be great if we could offer them a stipend. We're just not able to do so.
There's other great ideas too to honor. I really respect what Amy said, but I know of a lot of clinics and settings that do an end-of-year festive event, and maybe you give them a token of appreciation. So I understand Amy's barriers, and I also have seen people do things that aren't quite giving a stipend, but maybe you do a celebration at the end of the year.
Yes, and this is Marie, and I highly recommend celebrations. That is great, and you can invite in other staff who maybe don't know about the council yet. You can really make a great event around celebrating it, and gift cards, small gift cards. Sometimes organizations can get donations of gift cards, and sometimes, you know, just spending a little bit of money, it is a nice token of appreciation. I had a question for you, Amy. I was wondering, because you seemed like you had a great recruitment strategy, and you certainly got a good number of advisors for your for just starting. Do you have, looking back on your recruitment or looking ahead for ongoing recruitment, what out of your recruitment strategies seem to be most effective?
Sure. So actually, in Virginia, we had better traction, and I'm not sure why, other than several of our advisors did come from the Virginia Breast Cancer Association. So it seemed like when we were able to connect with volunteer type of organizations, several of those individuals came at us with a volunteer, frame of mind. I'm not sure why in Maryland it took us a little longer to get there, which is why that first April meeting was smaller, and we chose to move forward with individuals in Virginia, and we actually just brought on Maryland advisors, gosh, I think it was July. It took us several months in July, and we took the same approach, so I'm not sure why it was a little bit different. I would say that I encourage people, if they don't have interaction with patients, is really to get out where patients may be. So for us, we were looking for Medicare beneficiaries to try to make sure we're reaching up to Medicare beneficiaries. I had a couple advisors in Maryland. Once I talked to them during the screening process, they agreed to distribute the flyer within some caregiver groups that they participated in. So I don't know what the magic was, but I do think it was a combination of meeting them where patients were, and outreaching to volunteer organizations seemed to work best for us.
And Juliet, do you have anything to add, or Deborah, I know that you spoke about how you found out about the opportunity I'm also wondering if you had any other ideas about how to reach patients and families in your community.
Well, I think one of the great things that I see that Amy Lynn do, and again I captured, was that the timing and the communication is ongoing at all times, from the very moment I saw the flyer even till now. It's communication, 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 and it don't stop. And I think that that's what still drives me. I was already, she spoke on volunteer. My mindset is already volunteer. And with the Virginia breast cancer, we're kind of talking about the same conversation. So that just was like a puzzle piece for me on a personal level. And I just think timing, and if the mindset of the person is on target, on time, and just ready, I think that's what do it, you know. And communication, and we definitely have the communication. It don't stop, and I love communication.
Those are great examples, Marie, and I think they come right from a center that's making this happen. I would agree with all of Amy's examples. I just think broadcasting, asking your own families. I mean, I think we can break this down by putting great posters or signs up right in your waiting area and being very honest and just say, we want to redesign care in partnership with you. That's for patients and families. I think that's going to be a great process.
Great. And I think the last question I would ask, just to tie this back into the TCPI project, would be, I know that Amy and Deborah, you spoke about working on the patient portal, which is certainly in alignment with one of the change concepts in the change package. Are you all going back to that change package with the Patient Family Advisory Council? It can be quite overwhelming to look at all the change concepts and the potential change tactics, and I'm just wondering, are you going to be selecting different tactics or concepts out of that to be working in partnership with your Patient Family Advisory Council?
Yeah, I would say, so we did speak about that, and that was at the end of June, our last meeting. And I did bring it back to the PTN, the Practice Transformation Network team, and we do have to think through what is the best way to approach that. And I think it is going to be pulling out certain pieces to focus on. We're trying to balance all the different QIO activities and Practice Transformation Network activities, and some of them do cross over, so it makes sense for us to pick a few to focus on at one time so we're not overwhelming advisors. But you know, on the other side of things, I don't want to discredit or not show them everything too, because they may have ideas around other items of the change package. So that's something we're definitely in conversations about now, again, both on the Practice Transformation Network side as well as the quality improvement task. It's very complicated, so again, we're balancing, don't overwhelm them, but also, hey, we want them to know everything that, you know, is appropriate too, to have some discussions.
Thanks, Amy, for that. And so I do not see any other questions chatted in at this time. I'll just see if Jacinta is telling me that's the case as well. Just so that you all know, all of the slides are available on the PCPCC website, so make sure that if you didn't access them earlier, that you can access them. And I want to thank Juliet and Deborah for sharing their expertise with us today, and I want to thank you all for joining us. And if you have any questions, you can certainly send them on to Jacinta following this webinar, and she'll make sure to get them out to the presenters. And thank you so much, everyone.